Hello, everyone, and welcome. I'm Sheryl Gay Stolberg, a New York Times Washington correspondent, and I am back to covering health policy, a beat I had when I first joined the Times in the late 1990s after an 18-year diversion into White House, congressional, and political coverage. Just weeks after the coronavirus put most of the country on lockdown, the reopening has begun. Many states have started or plan to reopen in the next few days. Unemployment claims are at unprecedented levels, and most families sustain this long a period of time without income. The country is now seeing about 25,000 new COVID-19 cases a day. Deaths have surpassed 80,000. And many experts say that our testing capacity is nowhere near where it needs to be. Here in Washington, Dr. Tony Fauci, the nation's top infectious disease expert, just wrapped up testimony on Capitol Hill, and he told senators there could be serious consequences, including knee infection and death, if states reopen too quickly. So we're going to ask, how should governments balance all of this? I'm excited to be joined today by Ohio Governor Mike DeWine, who was one of the first to close schools and has spelled out ages for reopening his state, and Dr. Tom Frieden, the former director of the Centers for Disease and Control and Prevention, and currently head of Resolve to Save Lives, a health advocacy group. Welcome, Dr. Frieden and Governor DeWine. A quick note before we start. This conversation is being recorded and is audio only. And to our audience, you can submit questions anytime using the Q&A feature in Zoom. Please include your name and town. We like to mention where people are listening from. Governor, I'm going to start with you. In Ohio, while the average number of new cases isn't as high as it was late last month, it's still about 500 new cases a day. But rail and other businesses in your state have been allowed to resume, though you did decide to hold off on opening daycare centers. I see some of your fans out there in Ohio who want you to reopen faster are calling you a tyrant. Governor? Well, I think we have just lost the governor. So we will wait and see if he calls us in. I'm going to move back to Dr. Frieden. Dr. Frieden, I know you've been following closely all of these lockdown measures that were meant to give us time to slow down infections so we could get the right infrastructure in place to reopen. And I'm wondering, what in your view has the US accomplished in that time from mid-March through now?
We were staying home in order to strengthen our healthcare and public health systems. And they're stronger than they were, but not nearly as strong as they need to be. That doesn't mean we need to continue to shelter in place, but it does mean we need to recognize that it's risky. And as we come out, there will be more spread. And when there's more spread, we have to have the systems to protect our healthcare workers on the front lines, to protect the most vulnerable people in our society, in our nursing homes and elsewhere, and to box the virus in with the four-cornered approach of test, isolate, contact trace, and quarantine. If you do those four things well, you can prevent cases from becoming clusters, clusters from becoming outbreaks, and outbreaks from becoming epidemics.
So we just saw Dr. Fauci testify on Capitol Hill, and he actually emailed me late last night, giving me a little preview of his testimony, in which he said that he was going to warn senators that there could be needless suffering and death if states reopen too quickly. And during his testimony, he did in fact make that warning, and he said that in the fall, we are going to have big problems if we don't have enough testing capacity and contact tracing in place. And I'm wondering, do you agree with him? And what is enough?
Several things to understand about the COVID pandemic is that it's bad. The death rate in New York City is devastating, and it's just the beginning. The virus is still out there. We've been sheltering at home, but the virus continues to spread. And what we see all around the country and all around the world is that governments, which rely on and are guided by public health advice, do better. They do better not only in terms of fewer infections and fewer deaths, but also the ability to start the economy and protect the economy more effectively.
So I'm hearing that the governor is back on the line. Governor DeWine, are you there?
I am back on the line, yes. Sorry
Excellent.
about that. You
That's
were
okay.
breaking up.
We're happy to have you back. So I am going to reread what I asked you when we lost you. The number of cases, the average number of new cases in your state is not as high as it was last month, but you still have about 500 new cases a day. Yet, retail and other businesses in Ohio are being allowed to reopen. I know you decided to hold off on opening daycare centers. And I see that some of your fans out there who want you to reopen a lot faster are calling you a tyrant. So I'm wondering, how are you deciding what to reopen and what metrics are you watching?
Well, we're trying to do it in stages. Today, for example, we did open retail. In a few days, we'll see restaurants. One of the things we've done is we put together what we think is the best practices for whatever business that is or whatever profession that is. We've relied on health department advice, but also on people who actually run the businesses or who do that particular trade. For example, with the barbers, we had barbers, but we also put them in with medical people. So we come up with what we think is the best practices. But I'm very blunt. We do a press conference virtually every day. In the press conference today, I said, look, this is a risk. It's a risk if we open up. It's a risk if we don't open up. We have other concerns, obviously, with a down economy. There's long-term health ramifications to that as well. Not having enough money to take care of people in the future, as well as other things that go up. Domestic violence, et cetera. So we're trying to balance this. But I've been very plain to the people of Ohio. They've done a good job in sheltering. They've done a good job in keeping distance by and large. But we have to continue to do that. And the virus is still very much out there. As the doctor said, it's very tough. It's very lethal. It spreads, very, very well. So yeah, this is a risky operation, no matter what we do. And so we're trying to be very careful as we do this. The testing level, we have been able to secure a contract with Thermo Fisher a couple of weeks ago. This gives us, significant amount of the reagent that was holding us back. We also are beginning to produce the swabs in Ohio, so that is helpful as well. Our testing is increasing every week. We are now at a capacity at about 14,000 per day. Within the end of next week, we'll be up to about 22,000. And, we hope to see our numbers as we get the swabs out and get everything linked up. Our numbers are going to continue to go up. We're averaging now about 8,000 a day, but we're going up by a couple thousand every week. So that's still not enough. I've got a call tonight. I've enlisted a couple of our former governors to kind of head this up, Governor Taft, Governor Celeste, they were very helpful in getting this Thermo Fisher contract, but we've got to take our capacity up, well beyond what we're looking at. So 22,000 a day is not enough. We know we've got to get much, much higher.
Right, and just a little terminology for listeners who might not be familiar, and Dr. Frieden, you can correct me if I'm wrong, but the tests, as I understand it, have three basic components: the swabs that are used to take a sample, the viral transport media, which is used to keep the sample safe and clean until it can be tested, and the reagent, which is the chemical that can detect whether or not coronavirus is present. And you talked about reagent, and I know that that was a big stumbling block for you, and you made a little noise about it on Meet the Press, didn't you? Governor DeWine?
Well, we were getting frustrated. We were getting frustrated with the FDA, and they were doing their job, but we just wanted them to kind of focus a little bit more on it. And so I thought we had this thing worked out. I thought the FDA was going to, approve it, and it was not as fast as we wanted. So, but anyway, they got it done, and we're very happy about that. They approved it. We were able to get sign the contract and move forward.
And so,
but it's the doctor. Yeah, I'm sorry. Go ahead.
I was just going to, but I'm curious also for your businesses that are reopening. I'm wondering, your industries especially, will it be business as usual?
No, it's not business as usual any place. And if they can't meet the standards, they can't open up. Every employee, unless there's some medical reason they can't wear a mask, every employee in the state is going to be wearing a mask. The distancing is very, very important. The sanitation is very important. The checking on employees every single day. So, these are basic standards that, everyone talks about, but, we're making sure that these are in fact taking place because we have to protect our workers. And it's when retail is, as I said, started opening up today, people who go into retail have to be assured that, the best practices are in place. Now, as the doctor points out, that does not mean that we're not going to see an increase. We're having more activity, and we were already, frankly, having more activity as the summer, it got closer to summer, as we got better weather. We can tell by the data, cell phone data, et cetera, people are starting to move around more in Ohio.
So I'm going to just
moving around in the past.
Stop you right there, because you mentioned masks, and one of your own citizens, a reader from Columbus, Dee, sent in a question. She says, I was saddened to read of your decision to allow employers to reopen without requiring all customers to wear masks. Why did you do that? So why did you do that?
Yeah, we did it. We did it because as governor, we kind of hold all this together based on not so much the law or not so much enforcement from our 113 local health departments. That's part of it. But we have to have some consent of those individuals who are asking to do it. And it was abundantly clear when we talked about, in fact, we actually said, customers would have to wear a mask. It was abundantly clear that this was, we had a rebellion on our hands and people just weren't going to do it. But we are not giving up. Businesses can require that. Some businesses are, in fact. But part of my job is to try to continue to point out how important these masks are. Is one more layer. And so, as we go out, we're seeing people who are wearing masks, but frankly, we're not seeing enough of them. And so that certainly is a work in progress. But I've made it very clear, look, if we're going to open this economy as everybody wants and get back, it's contingent upon us doing absolutely everything that we can to slow the spread down. And that includes masks, that includes distancing, that includes sanitation, washing hands, all the other things that we need to do. So it's a work in progress. And the last thing we want to do is to fall backwards. But we're watching the numbers every day. We're watching the hospitalization rate. We're watching all the other numbers. And, we publish those every day. And so people can see how we're doing.
So I want to jump to a little bit of that uproar, Governor. You're a Republican. You lead a state that leans right, but Ohio is certainly a swing state. You've faced a lot of criticism from state legislators in your party, yet Sherrod Brown, the Democratic senator from Ohio, tells me that he believes your decisions have saved lives. I'm wondering, what do you make of the difference in how Democrats and Republicans view the restrictions and view this pandemic?
Well, that's you
Have I
know,
stumped you?
you're the expert. I'm going to let you decide, or not decide, but kind of report why you
Oh,
think.
you're the politician.
You know, but look, I think there's a big divide. Yeah, you know, after doing this for 40 years, you know, I'm not sure what I know after 40 years. But the thing I will say is that there's a big divide between rural and urban, and I think it's just as much an urban-rural divide as it is an ideological divide. I think people in the rural area, while there is COVID-19, it doesn't seem as apparent. They're not in as close together. And I think you know, there's a more of frankly, of an independence, less conformity. So I think that is just as much a factor, if not more so, than any kind of party affiliation or ideological. Now, you know, obviously, you know, a state like Ohio, in a rural area, we have, you know, it's more Republicans. But look, we're getting criticized from people opening up too fast. People say we're opening up too slow. Get this thing. We can't let our economy just totally continue to be shut down. On the other hand, this virus is very dangerous. It's out there, and it's just as much out there as it was a month ago. So it's a balancing act we're trying to do. And as I said, we're monitoring this data every single day. And when we're starting to see, if we start to see spikes, you know, we're going to certainly report that to the people of Ohio, and if necessary, we're going to do, you know, whatever we have to do, because this economy coming back is contingent upon us having some control of the coronavirus. So even if people, you know, don't think they're afraid of the coronavirus, as I think everyone should be, but we can't come back unless people feel that they can go out and have some confidence. And, you know, coronavirus running amok in Ohio or any other state is just a disaster economically as well as it is from a medical point of view.
So I know you have to run, but before I let you go, I'm going to ask you one more tough one. President Trump said yesterday, "We have met the moment and we have prevailed." Is he right?
Well, the Trump administration, the vice president, the president, frankly, have been very helpful to Ohio in cutting through red tape and getting things moving for us. We're not, you know, where we need to be in testing in Ohio. We're a lot better than we were a week ago and a lot better than we were 2 weeks ago. And we think we have a pathway to get testing where we need it. Testing is not the only thing. The tracing, we're standing up a group of about 2,000 people in Ohio, and if that's not enough, we're going to keep adding more people to do, you know, to up the tracing. We already have 700 or 800 people, but we know that's not enough. So we think applies to our request to people to become tracers. So it's the testing, it's the tracing, it's also all the other things that, you know, are just part of this. We're trying to take a holistic approach.
Well, thank you, Governor. I know you have to run, and so we will let you go on that note. And we will turn to Dr. Frieden.
Thank you very much. Good to be with both of you. Thank you.
Thanks, Governor. Bye-bye.
Thanks, Governor.
And so, Dr. Frieden, you have said that many places are, quote, reopening based on politics, ideology, and public pressure, and not science. And I'm wondering, what would a reopening based on science look like, even if it had to take into account economic and political realities? How would that work?
Well, I do think that economics are important. Our goal here isn't merely to prevent deaths from COVID, it's to prevent ill health and deaths from all conditions. And where you see the collapse of primary care systems or the significant problems providing very important healthcare services or economic hardship that's leading to ill health, you recognize there has to be a balance. You have to look at the core health, public health, epidemiologic, and societal factors that go into the decision of when to loosen restrictions. And it's really important we get past some false dichotomies. It's not open versus closed. We've never been closed. Essential businesses continue, healthcare continues, and when we open, it's not going to be like before. It's going to be a new normal. So it's more a question of degree than of on-off. And the factors that we look at are our healthcare workers protected? And we've made progress there, but not nearly enough. If you look around the world, and we're a global organization, so we have offices around the world, we work with dozens of countries. There are countries which have prevented their healthcare workers from becoming infected. And that's not just about PPE. PPE is important, but it's only one part of a comprehensive program. We also look at what we call the box it in strategy: testing, isolation, contact tracing, and quarantine. Those are 4 corners of a box, and you have to get them all in place or you won't be able to prevent those explosive outbreaks.
And I want to jump in right there because we're getting a number of questions from readers about contact tracing. So Michelle Desiree asks, how would any tracing program comply with a person's privacy rights? Which I think is an interesting question, and maybe lots of folks don't know how contact tracing works, and you can talk about that. But also a reader in San Antonio, Texas, Bruce, asks, are there any state or federal public health authorities using the contact tracing technology being developed jointly by Apple and Google? And I will confess that I was not aware that Apple and Google are developing contact tracing technology. So what can we say about that?
Well, first, it's very important to understand the basics of contact tracing. If you have an infectious disease that's reportable, that is not a secret from the health department. That information is shared with the health department in the interest of public health. And whether that's tuberculosis or HIV or typhoid or COVID, the health department learns of your infection. And that's important because they need to make sure that you're isolated, and they need to reach out to you and see if you have any medical or other needs. And they'll interview you and ask you to help identify who you may have exposed. Contact tracing is about building a human bond between the health department and the patients who are infected and their contacts. For the patients, it's about providing supportive services and helping to identify who they may have exposed. For the contacts, it's about warning them so that they know if they've got the infection and they can take steps to make sure they don't spread it to others. That's particularly important because we now recognize that people without symptoms can spread the infection. And therefore, if you feel fine, you've been exposed, you weren't told you were exposed, you go visit your mother or father or grandmother and you infect them and they die, that's a failure of society. That's a failure of government to warn you. In exactly the same way, if a hurricane were coming and you weren't warned and you didn't protect yourself and your family, that would be a failure. In terms of apps, there's been a lot of confusion about what are called proximity tracing apps, and Google and Apple have collaborated and said they're going to develop something. This is not what contact tracing is. This is a new idea. It may have some role. It's unproven. It raises significant privacy concerns, and there are significant feasibility questions about it. Will it work? Will it have false positives and false negatives? And I think, frankly, it's a distraction. What we need to do is scale up just what Governor DeWine was talking about: hiring people, training them, supervising them, empowering them, giving them resources so that the patients and the contacts are the VIPs of the program, and we can support them so that we can stop the spread of the virus.
So I've been talking a lot lately too on Senator Bill Cassidy. He's a Republican from Louisiana, and as you probably know, they had a pretty bad outbreak there after Mardi Gras. He's also a doctor, and he has talked a lot about doing serology testing, blood testing, and then to determine who is immune, and then creating a kind of a government registry, almost an immunity registry, and that people would have kind of like an immunity card clearing them to go back to work. And I'm wondering what you think about that, and especially what you think about the privacy concerns with such a plan.
It's premature to think about what are called immunity passports. I'm sorry, it's premature to implement immunity passports, it's not premature to start thinking about what that might look like. There are at least 4 big unknowns. First, a lot of the tests out there that the FDA allowed on the market don't work well. They're inaccurate. They should be off the market. So there's tremendous confusion. Second, even if you've got an accurate test, we don't know that antibodies equals immunity. Third, even if it does, we don't know how complete that immunity is for different people or when you get a heavy exposure. And fourth, even if it's complete, we don't know how long it's going to last. So we have a lot of unknowns. We hope antibodies mean immunity. We hope it will be long lasting, but I wouldn't bet my life on a hope.
I think we should talk about a vaccine also. Dr. Fauci just said at this hearing that he does not expect a vaccine to be available in time for school to reopen in the fall. That's not a surprise. He's said in the past that he does not expect a vaccine for 18 months. So particularly with respect to schools, I'm wondering how educators, how school administrators should make a decision about whether to reopen.
This is one of the tough questions, and there are a lot of tough questions. I think what we can do is provide some principles. For example, for people who have underlying health conditions, children who are medically frail, or staff who have cancer, heart disease, lung disease, diabetes, they may need to stay away longer. Second, we're going to base decisions on societal benefit. Daycare, for example, is probably lower risk than most other environments and may be very important in getting communities back to work. We're also going to have to base decisions on data. When we look all around the country, all around the world, the places that do best, base decisions on data. And we're going to have to be creative, figure out some ways to ensure there's hand sanitizer, face masks, physical distancing to the greatest extent possible.
So, and a lot of readers are also asking this, which is really the basic question that we started this conversation with, and that is, why has it been so hard to get the testing supplies that we need? What are the challenges? Why is this so difficult for states? And how long will it take to get the national supplies where we need them to be?
Well, I'm not in government now, so I can't reflect on what all of the problems have been. This is an unprecedented pandemic, and I think it's important that we just be frank. We do not have enough tests today. That doesn't mean there hasn't been progress. There's been a lot of progress, but that does mean we have to prioritize. We have to outline which patients are most important to test to save their lives and to limit the spread of the infection so we can control the pandemic and begin to box it in. And just because we don't have enough tests doesn't mean that there aren't a lot of other things we need to do. Lots of activities are important to have a comprehensive approach. Testing is one of them, so is contact tracing, so is isolation. For example, many countries around the world are isolating people who have the infection, not just in their home, but in hotels or other places. That may need to be done if we want to really tamp down the level of infection. And if someone's living in a small place with their elderly parent, that'll be a very important intervention. So the response is complex. It's urgent. It's urgent for our health, and it's urgent for our economy.
A lot of talk here in DC also about South Korea. South Korea has had 256 deaths from coronavirus. The United States has had more than 81,000 deaths. And I'm wondering, when you look at the course of the pandemic in these two countries, what accounts for the difference in your view?
I'd like to look forward. What we need to do right now is to scale up our capacity to contact trace, to quarantine, to isolate, to make sure that whenever we can control the clusters and cases so they don't explode. That's crucially important. It's so important that I'm confident that we will devote the resources needed to make it happen, but we need to do that quickly. South Korea and other countries in Asia had gone through SARS. They had a muscle memory of how terrible it was, how difficult it was to control. And they reacted very quickly.
You've been a director of the CDC, as we all know, and your successor, Dr. Robert Redfield, told senators today that the contact tracing capacity that CDC had was simply not enough, that the virus got ahead of them and they weren't able to contain it. He really made a plea for lawmakers to focus on building up the nation's public health infrastructure. And I'm just wondering, from your perspective and your time at the CDC, what were the challenges in getting the funding that you needed? Were you able to convince members of Congress that a pandemic threat was a serious threat?
Well, on the one hand, we had really good support from House and Senate, both sides of the aisle. On the other hand, there was always a problem with the competition for money. That's why last week we proposed with a bipartisan group of former Senate Majority leaders, Dr. Frist and Tom Daschle, and a series of others, all of the deans of public health schools in the United States, a new mechanism. So Congress doesn't have to choose between funding Head Start, say, and public health defense. We proposed a health defense operations to get out of the system where we chronically underfund and don't prioritize public health. This is basically a way to make sure that we're investing in our health defense the way we also invest in our military defense.
Question from a reader, Amy, and it's a question that's been on the minds of a lot of folks here in Washington. Has the CDC's role been minimized during this pandemic? And if so, what is the result of that? And I believe you've written about this, so tell us what you think.
Fighting this pandemic without the CDC front and center is like fighting with one hand tied behind your back. On the one, and it is true that there's a lot CDC is doing. Americans are voting with their clicks. There have been 1.2 billion visits to the CDC website. The CDC has done dozens of investigations. They're now producing very important scientific data. They've scaled up activities throughout the country, and they provided guidance on a broad range of topics. But we'd be better off, and I would personally feel safer if we were hearing from them regularly, because they're the experts in this. They can explain to us, for example, why did we now recommend that people wear masks? It's counterintuitive. So if we had gone through the process of learning how that was being discovered and had that explained clearly, I think it would have been better for the country.
I'm interested in your thoughts about the importance of communicating in a pandemic. I think a lot of people think that, it's important that we have good science, it's important that we have testing, vaccine, or whatever, but talk to me a little bit about the role of communicating to the public and maybe why that has been problematic with COVID-19.
Communication is absolutely central. You want to make sure that people understand and have confidence in the recommendations that you're giving. You want to make sure that people understand what's happening so that they can take steps, they can empower themselves with the information you're giving. You want to have transparent information on where we are in terms of testing, contact tracing, trends that are occurring. There's such an enormous amount of news about COVID, it's sometimes possible to lose sight of the really important things that are happening. And that's why briefings, as the Health Commissioner of Ohio has done, are really models of sharing information when you know it, being frank about what you do know and what you don't know, leveling with people about it's going to be bad, it's going to go on, but we're going to get through it. It's a complicated set of messages because on the one hand, this is the worst infectious disease outbreak in a century. On the other hand, most people are going to be okay. 99% of the people who get it will survive. So you have to say we do have to balance the harm to human health, the harm to economy. How do we move forward so that we can restart our economy without rekindling explosive spread of the virus?
So question from a reader who's a nursing student in Georgia, a reader named Kat. asked, what should businesses have to do to be deemed safe enough to reopen and to operate safely?
This will really depend on each business. It's a question of physical distancing. I think we're going to see mandatory hand sanitizer when you walk into buildings. Um, you see sometimes a sign in the door, no shirt, no shoes, no service. You might see a sign, no mask, no service. We need to understand that wearing a mask is about being responsible, because you might be spreading the disease to someone who could die from it without knowing it.
Okay, so let's talk about restaurants. You can't eat with a mask on, and I think restaurants, as we know, really have suffered during this pandemic. I know in some states they are opening up restaurants and only allowing outdoor seating. That works in Florida, but it probably doesn't work in North Dakota right now. So what about restaurants?
There are some industries that are going to have more trouble than others. Tourism, travel, restaurants, bars, nightclubs. These are places where it's very, very difficult to see the kind of safe environment that you would want to see. Where the disease is spreading widely, it's going to be very difficult to open those places safely. And that's why it's in everybody's interest to get the virus controlled.
Lots of criteria being tossed around for what government should look at to consider reopening. Yesterday in the Rose Garden, President Trump said that he wants states to be able to test 2% of their populations. And I'm wondering, is that enough? And if not, what is enough? And what are the criteria that you think matter in terms of reopening?
At preventepidemics.org, we put out a brief on this a couple of weeks ago, and we analyzed how many tests it would take. It comes out to about 400 to 500,000 per day in the US. That's about twice or thrice what we're doing now, just to do the highest priority patients, just to test those with symptoms, those being admitted to hospital, contacts, and others at high risk. So we don't have enough tests, and it's not just about how many you're doing, it's, are you testing the right people? Are you making sure that everyone in a nursing home with symptoms has tests? Are you making sure that nursing homes are periodically sampled to make sure that there's not a large outbreak that you're missing because many people don't have symptoms? Do you have a way of finding and stopping outbreaks in homeless shelters, in jails and prisons? It's not just about the number of tests, it's also about whether they're being used on the right people.
And let's talk about surveillance testing a little bit, because we know that right now, people who are getting tests are people who are sick. But public health experts say that it is very important to test a wide group of people, right? To see who's asymptomatic and also to see what the prevalence is, I believe. So talk about that a little bit.
Well, for example, if there's a single positive case in a nursing home, everyone in that nursing home should get tested, because we know that there could be a large outbreak. And as I said more than 2 months ago, nursing homes are ground zero for COVID-19 in this country. And unless we take urgent action, there will be more than 100,000 deaths in nursing homes alone in this country within the next year. So we have to take urgent action on certain highest risk groups.
And I think we've got just a few minutes left, so I'm just going to ask you one more question to wrap up the event. We have talked a lot about what officials should do and consider in reopening, but what do you think ordinary people should do as their communities may be reopening, even as cases continue to climb? Some people feel unsafe. A reader from John from Texas said that, what do you say to employees called back to work who are feeling unsafe? What's your advice?
First, I'd say, take a look at what your risk is. If you're over the age of 60, or you have an underlying health condition such as diabetes or heart disease or lung disease, you're going to want to stay safer longer. And that includes being careful about those in your family, because if they go out and get infected and bring it home, that also puts you at risk. And that's a particular risk for people who are over 80, where the death rates, unfortunately, are really quite high. If you do go out, by all means, wash your hands. Wash your hands before and after you touch your face. Try not to touch your face as much as you might want to. Wear a mask if there's COVID spreading in your community. If you feel sick, don't go out. Keep in mind that certain things are much lower risk. Outdoors is way lower risk than indoors. Indoors, 6 feet away from other people, lower risk. Think also about things like doorknobs and elevator buttons and banisters. Unfortunately, this virus does stay on contaminated surfaces, and that is one way that people get infected.
Well, Dr. Frieden, I want to thank you so much for your time. That was Dr. Tom Frieden, former director of the Centers of Disease Control and Prevention, and now head of Resolve to Save Lives, an initiative of Vital Strategies. And I also want to thank Ohio Governor Mike DeWine for joining us earlier. This conversation is part of a slate of digital events the Times is producing to help readers navigate the world we find ourselves in today. Next Monday, on May 18th, you can hear from science and health reporter Donald McNeil and Tara Parker Pope, the founding editor of Well, to preview, quote, the new normal moving forward. They will offer advice for keeping safe, healthy, and sane in the months ahead. So bring your questions. And to find out more about our full slate of digital events, please visit timesevents.nytimes.com. And finally, we want to give a special thank you to all of our subscribers. And I want to say this very personally, as someone who has been at the New York Times for more than 20 years. You make our work possible. We look forward to speaking with you again. We couldn't do it without you. Thank you.
Thank you.
Thank you.